feeling so nauseated, like I'm about to throw up. Can someone come to help me, please?
Hi, I am your nurse. I have some medication that will help treat your nausea and vomiting. I am going to administer Ondansetron through your IV line to relieve your nausea and vomiting.
Why did I feel so nauseated? And what medication did you just give to me?
Following surgery, nausea and vomiting is a common side effect due to anesthesia. The medication I just administered is called Ondansetron, which is an antiemetic or a 5-HT3 antagonist. It is commonly used following chemotherapy or surgery to prevent and treat nausea and vomiting. Ondansetron is contraindicated with those who have hypokalemia, hypomagnesemia, heart failure, and radioarrhythmias. This can further prolong the QT interval, resulting in the patient feeling faint or having any seizures. Use cautiously with people who have hepatic impairment, abdominal surgery, are pregnant or lactating because it can cross the placenta and enter breast milk. Before administering the medication, make sure to auscultate the patient's bowel sounds and assess for abdominal distension, nausea, and vomiting. When administering Ondansetron through IV push, it should be undiluted with a concentration of 2 mg per ml. It should be given at a rate of at least 30 seconds, but preferably 3 to 5 minutes. Do not administer too quickly. This can cause dysrhythmias and neurological changes with the patient. Administering Ondansetron through an IV push in a Y-site tubing, assess if the medication that is infusing is compatible. Some compatible medications include acetaminophen, morphine, digoxin, heparin, and more. Some incompatible medications are acyclovir, furosemide, allopurinol, sodium bicarbonate, and more. Some adverse effects the nurse must look out for are headaches, dizziness, drowsiness, fatigue, weakness, constipation, diarrhea, abdominal pain, dry mouth, extrapyramidal reaction, serotonin syndrome, dosata de Pointes, Stevens-Johnson syndrome, and toxic epidermal necrolysis. After the administration of the medication, the nurse must monitor the patient's ECG for any indications of prolongation of the QT interval, signs and symptoms of serotonin syndrome, which are mental status changes, tremors, seizures, nausea, vomiting, dizziness, tachycardia, and diaphoresis, and also assess the skin for any rashes that are linked to toxic epidermal necrolysis and Stevens-Johnson syndrome. Advise the patient to notify the healthcare provider if symptoms of irregular heartbeat, serotonin syndrome, Stevens-Johnson syndrome, and toxic epidermal necrolysis occurs.